Guests in my podcast are like my coffee, strong, flavorful, and they always brighten my day. We have amazing conversations over coffee. We cover everything from growth to inspiring communities, empowering customers, and sharing exceptional leadership moments. In this season, we're hosting incredible leaders whose journeys inspired me to keep growing and learning every day. I'm Imane, and I welcome you to my podcast, Coffee with Me, Leaders of Change. Welcome to another episode. It's been a while, and I'm so excited to be back. With me today is a leader whose innovative work is shaping the future of surgery, blending healthcare with advanced technology. He is none other than Dr. Gao Yujiao, a consultant in hepatobiliary and pancreatic surgery at National University Hospital and the Assistant Group Chief Technology Officer at National University Health System here in Singapore. Some of the cutting-edge technologies he uses include holomedicine and the digital twins, and his research and work here are revolutionizing liver and pancreatic surgeries, taking healthcare here to the next level. I'm honored to have this chance of learning more about his leadership journey, learnings and inspirations, and sharing these with all of you. Hi, Dr. Gao. Welcome to my podcast.
Thank you.
You know, we've met 2 years ago when we were discussing the HoloLens program. And since then, I've been following you on social media, and you are a true inspiration to everyone, including myself. Hence, really excited to have you today.
Thank you. Thanks for having me here.
The first thing first, you have two passions, technology and medicine.
Yes.
And then you come from a whole family of engineers and technologists. How did you mix both your passions for medicine and technology together?
I think it's a very chance occurrence that these two kind of met along the way. When it comes to technology, it's always been a part of me, and I think a part of my hobby and passion since young. The medicine part came from essentially, I think, my exposure to the different topics when I was in school. When I started doing biology in secondary 3, and so that piqued my sort of interest and passion into the whole biology and medicine side. I guess the intersection between technology and medicine started when I was still a trainee. It started essentially with a AI project to look at big data to try and predict how patients will progress for example, when they come in with acute appendicitis or pancreatitis. So I think this was, almost 10 years ago.
Wow.
When we first started using, machine learning and AI to churn and process some of the, large databases that we have. The journey that I have with Microsoft, as well as the HoloLens, came in November or December 2019. So that was when actually we were invited to attend a half-day workshop at Microsoft to look at the HoloLens 2. So they had just launched it, the HoloLens 2 at a point in time. So they invited NUHS. So we came and we spent about half a day with the team here at Microsoft, playing with the device, looking at how it is, and just brainstorming and thinking about how it can potentially be used in healthcare. We could tell that this was essentially going to be the next phase and the next era of technology coming into the healthcare space.
And 5 years on, since 2019, how do you feel technology helped healthcare, but also helped you in supporting, your patients and better serving your patients?
5 years ago, if you talk to someone about AI, I think outside medicine, people were already using it. But in the medical side, it wasn't that prominent or that accepted by most people in the community when it comes to using AI. And a little bit of that, I wouldn't say distrust, but a bit of apprehension as to what AI is going to do and what its potential is in healthcare was a bit unknown. But I think 5 years down the road, most of us have a lot better understanding of this new whole area of artificial intelligence, or sometimes we call it augmented intelligence, because it is not really artificial in a way. And I think it's sort of expanded the horizons and expanded the whole field of medicine into looking at ways and methods of looking at data and treating our patients, delivering healthcare, things that we never thought were possible have become something that everyone is working towards. So for example, using mixed reality in surgical planning, in surgical guidance, image guidance, even patient counseling. These were things that, as a trainee, I hope that one day we will have. I remember when I was a trainee and there was one time we were doing quite a complicated case. And, during the surgery itself, I was trying to recall, what the scans looked like. We had to go to the computer to look at the scans again, to see where we are, where all the landmarks are and everything. And I remember thinking to myself, if only I had like a hologram in front of me to tell me exactly where everything is, right? I mean, either you wear it as a visor or there's like, a little thing on the floor that pops up and tells you where the structures are. I mean, how great would that be? Right? And 5 years down the road, it's a reality. We can put on, the HoloLens 2 and you have like this entire panel of 3D holographic images that you can use for image reference. You can superimpose it onto the patient, help you guide the surgery, help you make sense of information and data a lot better. These 5 years have been quite tremendous, I would say, in not just the development of AI, XR, and technology itself, but also specific to healthcare. The medical community becoming more and more receptive and acceptive that technology is going to become part of healthcare delivery. And it's not something that we can ignore. It should be something that we embrace. There are unknowns. There will be things that we will never understand completely, but it shouldn't be something that, we keep to the sideline or be, exclusive about and be more open to new ideas.
That's amazing. And you are now training younger doctors, and you are now, guiding them into embracing technology and leading in the technology developments. What traits do you see for the younger trainers, training doctors, while embracing technology and, becoming better leaders?
I think one of the most important traits is to be able to move out of their comfort zone. In the past, there wasn't that much of exposure to technology, innovation, medtech. Even when we used to do research, it was more on clinical research, looking at patient data, doing clinical trials. There were small groups that were doing medical technology and medical innovation, but it wasn't something that was a very natural field for us to go into. And even for those who do have an inclination towards innovation and technology and everything, even for myself, there's always this fear that, what if things don't work out, right? What if, we go into something, we do a new technology and it doesn't work? Does it mean that we have failed and everything? One important trait will be that, they are comfortable knowing that there are a lot of unknown out there, especially when we start venturing beyond our clinical training, our medical background and our medical foundation into fields that we are not entirely comfortable with, but at the same time we are keen to try. Because if we don't try, then you never know what's going to work, what's going to not work. But I think the first step would be the willingness to go beyond our core training or what was taught as a foundation when it comes to clinical skills and all this, and go beyond that to try new things and expand the horizon, go into different industries, and to bring those experiences back into healthcare and see how we can transform the way we treat our patients, the way the healthcare sector works, how health delivery policies and everything can be different to what it is today. So I think that first thing will be that willingness to try. Right? I think the second would be, just now, like what we mentioned, actually knowing where our limits are and not going beyond it. Because I think once we go beyond our own capabilities and our own limits, I think that's when the chance of failure is going to be very high. It's a bit different from going outside your comfort zone. Going outside the comfort zone to me is more about trying new things, right? But going beyond what our own limits are, to me, is that we are taking on things beyond what we can handle as a person. If you see that early and you find the limitations early, and that's where, for example, collaborations come in. right? You bring in partners, you bring in collaborators who can fill the space that we know we cannot do, but we work together as a team. So that whole, collaborative effort, teamwork, and everything is also important. So nowadays, when it comes to medical innovation, medtech, when we do sort of try and talent spot or talent scout for the next generation of innovators, even from the fresh graduates or even from within the medical students community and everything, a lot of it is actually their own initiative. We do sort of give them the exposure. So right now we have modules within medical school to teach them about biomedical informatics. We actually have a minor in biomedical informatics in the School of Medicine now, which we never had. We have exposures for an opportunity for them to be attached to different teams within university or within industry to let them explore. And a lot of them will actually find the inner spark in them that, hey, this is something that really interests me, and this is something that I wouldn't mind trying as part of my journey to become a doctor and a health practitioner. And this is when we work together with them and we see this new group that's coming up, and we help to nurture them, to give them the opportunities and essentially help them to, in a way, maximize their potential and to show them the possibilities of what they can do in healthcare innovation.
I'm sure that you are an inspiration to many of them, and you continue to inspire them moving forward. Talking about inspiration, what was your inspiration and who was your inspiration when you were a trainee?
I wouldn't say that there is one particular person. I think it's a lot of people who have inspired and mentored me along the way. And I think each of them has helped to develop and nurture me in their own ways. I would always say that the people that I look up to the most will still be my parents. I remember when I was young, in kindergarten and primary school, my parents worked very hard, and my parents made sure that they provided for us as best as they could. In a way, entrenched in me that sense that I have to work hard in order to do well in what I do, no matter what specialty or what occupation I'm in. My brother and I are doing, I think we're doing pretty okay now, and I'm pretty sure my parents are quite proud of us. The values that I learned from my parents is something that has carried me through all the way. I think I learned a lot from my seniors and even sometimes the juniors. They may come with very different perspectives of life, and a lot of them also have very unique life experiences of their own. And sometimes when I talk to them, I say, wow, that's quite interesting. I mean, I never thought about things from that perspective. This is something that's completely new to me. And said, yeah, I learned something today. And I think another source of inspiration now, so more than ever, will actually be my patients. You see the patients from the moment they enter the hospital and their entire journey all the way to the end. I have to say that I do really enjoy long conversations with my patients. There's really a lot to learn from them. And also because, as healthcare practitioners, as doctors, right, we shouldn't see our patients as just cases, right, or problems that we have to solve. We see them as human beings who come to us because they need help. And a lot of times, I get very good counseling sessions from my patients, and a lot of them are older. With their life experience, I actually gain a lot of inspiration and motivation from them. I have to say that I'm quite blessed and quite fortunate in a way that I have many people from different walks of life, different aspects of life who have helped me along the way to inspire me, to remind me of who I am, why I'm doing this, what my values are.
I love the fact that you are taking inspiration from everyone and everything around you, whether your patients or your trainees or your seniors, and love, the story about your parents, and shout out to your parents. They must be really proud of you and your brother. And the more you talk, the more I see a lifelong learner. And, we were discussing earlier, you were in Korea continuing, learning as a consultant. And, I want to hear more about outside of Singapore, how you continue your learnings around the globe.
In Korea, I went there because I was there for a advanced specialist training or fellowship for liver transplant, because they do a lot more cases than we do here in Singapore. But apart from picking up the clinical skills over there, what I also learned is different considerations from the healthcare policy and the healthcare sector, because Korea is such a big country, right? They have populations that's many times that of Singapore. They have challenges that are very different to those that we face here. And they have issues that, we probably wouldn't even think will be a problem here. For example, access to healthcare facilities, having to travel from another city over. How do you actually follow up the patients the moment they get discharged and everything? But also hearing the perspectives of the specialists, the professors, the trainees, the residents there, of how their system works for them. There are also, of course, challenges faced by systems anywhere, right? We know of the unfortunate situation now in Korea where the healthcare system is in a little bit of a crisis because of some of the policy issues there. Right? But at the same time, then you think about, okay, how do we prevent something like this from happening in Singapore? Right? Are there issues that perhaps we need to address early on? Are there things that we are not seeing that we should, start addressing? And I think having that perspective beyond Singapore allows me to draw on the experiences of a lot more people around the world, right? Not just Korea. We have friends in Japan, Australia, Taiwan, China, US, UK, Germany, everywhere. Right? And it's very interesting to hear what are the things that work in their system, what are the things that perhaps may not work so well, right? Some of the things that perhaps they wish that they would change. And then after that, coming back and say, okay, how can we learn from this? Having that global perspective and that global, in a way, knowledge of how things function outside Singapore has really opened my mind and my eyes and also my ears to a lot of these issues that perhaps if, let's say, we were just to remain within Singapore itself, we might not have thought about or we might not even come across. The experience in Korea was, I think, beyond what I thought I would gain. And my initial thinking was to go there and learn the technical skills, the operating skills from the surgeons there. But I think what I brought back was a much broader perspective of how healthcare and how health delivery systems are going to work, how training can be so different between different countries and different healthcare systems. And in a way, also seeing how fortunate we are here in Singapore to have the healthcare system that we have.
I've been in Singapore for 14 years and really, really grateful and privileged for the healthcare that you provide in Singapore itself. Last question. If you go back in time, 20 years, 30 years, what would you tell your younger self?
Honestly, I would tell my younger self, don't change anything. I think there are sort of mistakes and, different paths that we take along the way. But to me, those are important because those are experiences that essentially led me to who I am today and what I do today. If I hadn't made some of the mistakes that I made in the past, I may or may not be where I am today or the person that I am today. If I were to go back 20 years and tell and meet my younger self, I would just say that actually just go with the flow and see what happens.
Live with no regrets.
Yeah, live with no regrets. Yeah, because whatever happens along the way, they are all life experiences, be it good or bad, right? That essentially helps to shape and help us become who we are in our characters, in our values, in our beliefs.
Thank you so much,
Thank you.
Dr. Gao. I really enjoyed the conversation and please continue inspiring us.
Thank you, man. Thank you.
And thank you all for watching us.